Hello there, giving the news a twist on this episode of Brazier. As the politicians debate a Christmas curbed by COVID, we bring you glad tidings from South Africa. It's official. Omicron is less deadly than Delta. 500,000 jabs today, but at what cost to cancer care? I'll welcome Prof Sikora to discuss whether RGPs should be putting boosters for healthy 20-somethings ahead of testing older folk for tumours.
So my key request today is this: before and immediately after Christmas, please minimise your social mixing with other households as much as you can.
Nicola Sturgeon insists she hasn't cancelled Christmas, but as the First Minister reimposes social distancing, I'll talk to someone worried sick about Scotland's pubs and bars.
And say this once and for all, that although we've seen plans for universal mandatory vaccination in some countries in Europe, I will never support them in this country.
Yeah. And the Conservative MP, Andrew Bridgen, will join me in the studio to discuss how COVID is drawing new ideological battle lines in British politics. Because we know you can't face a whole hour of COVID gloom, we bring you the story of the disused railway campaigners who took on Big Motorway and won. All that plus the Brazier angle and tonight's Twitter poll. But first, the news with Polly.
Good evening. MPs have voted tonight for tougher COVID restrictions in England. The Commons have seen Plan B measures approved which favour COVID passes for entry into nightclubs and other large venues in the country. Face coverings indoors in venues such as museums and galleries will also stay. And mandatory vaccinations for NHS and social care staff by April next year have also been brought in. And from 10 a.m. tomorrow, anyone aged between 18 and 29 in Scotland will be able to book a booster through the NHS Inform website. Appointments will be added to the website daily, while vaccine capacity will be increased over the festive period. This comes as Nicola Sturgeon announces she's not cancelling Christmas. Scotland's First Minister is asking people to limit their socialising to a maximum of 3 households during the holiday period.
Turning to Christmas Day specifically, or Christmas Eve or Boxing Day, or whenever you have your main family celebration, we are not asking you to cancel or change your plans, and we are not proposing limits on the size of household gatherings. Keeping your celebrations as small as your family circumstances allow is sensible too. Make sure everyone in your gathering is vaccinated and has done a test in advance. Keep rooms ventilated and follow strict hygiene rules.
In other news, the Prime Minister has described the murder of 16-month-old Star Hobson in West Yorkshire as shocking and heartbreaking. Boris Johnson also says lessons need to be learned and children must be protected from what he called barbaric crimes. Savannah Brockhill, pictured on the right, was convicted of murdering the toddler. Her partner and Star's mother, Frankie Smith, seen on the left, has been found guilty of causing or allowing the death of a child. Star's great-grandfather says he saw the worrying signs of abuse in the family.
My blood used to run cold. I just had a horrible, uneasy feeling about the situation. We even called the car Christine after a horror film in the early 80s. And then Anita used to say, you do realise little Star's going to finish up a star in the sky. Kept seeing Frankie bruised, and it was just like a domestic relationship.
Now, Malta has become the first European country to approve the personal use of cannabis. The law, approved by 36 votes to 27, allows adults to possess up to 7 grams of marijuana and grow up to 4 plants at home. The country's Equality Minister says the move will ensure there's a safe and regularised way of obtaining the substance. You're up to date. Now back to Brazier.
Well, let's start with the good news, and given the gloom that's been hanging over the country for 48 hours and more, you might be surprised by how much of it there is tonight. First, as Boris Johnson is wont to say, let's be guided by the science. And there we have promise. The first real-world data on Omicron is in from South Africa, and it's encouraging. Omicron is significantly less deadly than Delta. Yes, South Africa has a younger population, which makes it hard to compare demographically to Britain, but scientists have tweaked their data to take account of that. And they find that Omicron is at least a third less virulent than other strains. Another study also gave us good news about the protection we get from serious illness provided by just 2 vaccine doses. And as for the third jab programme in Britain, 500,000 boosters were administered yesterday, a record. It's a measure of how desperate the government is to get that number up, that the 15 minutes we wait as a precaution against side effects after the jab was tonight cancelled to save time. Well, there is a downside, and on the downside, those who said Boris was overstating the case when it came to the transmissibility of this virus might need to think again. Omicron is spreading with unprecedented alacrity, up to eight times quicker than Delta. There were 60,000 cases of the new variant in a day, the highest official figure for almost a year. We were told the actual daily figure is probably closer to 200,000. And suddenly 1 million new cases of COVID a day doesn't seem so unachievable, does it? Well, in a moment, I'll talk to one of Britain's leading clinical voices, Prof Sikora, about what this will mean potentially for cancer cases. And we'll go to Scotland, where the SNP insisted today that Christmas isn't cancelled, even as it reimposes social distancing. And we'll talk to a prominent human rights lawyer about whether what we're seeing is set to become a feature of Christmases to come. But first, as many families sit down tonight to think about what this will mean for their festive season plans, whether to sit down on Christmas Day with elderly relatives, for instance, our politicians have been on their feet voting on the different elements of Plan B. The government's got its way, but in the face of big backbench revolt, really. But how big? Let's turn to our political editor, Darren McCaffrey. Darren, 98 rebels on the Conservative backbenches for the vaccine passport vote.
Yeah, indeed. In fact, actually, the tellers have just corrected that in the last couple of minutes. 99, Collins. Essentially, 100 Conservative MPs have defied Plan B, have defied the government and indeed the Prime Minister tonight, particularly on this issue of vaccine passports. Many felt it was a line in the sand they were not prepared to cross. This is a major rebellion, even by historic standards. Forget about Boris Johnson's biggest rebellion since he became leader, 2.5 years ago. This is almost as big as the rebellion that Theresa May faced when she put down the Brexit vote first time round. In addition to those 99 MPs, we believe 17 Conservatives abstained, so didn't vote at all. And this is from across the party, Colin. It includes a former leader, it includes leadership candidates, includes dozens of red wall Conservative MPs who were elected only a couple of years ago, in part because of Boris Johnson as Prime Minister. It includes 4 select committee chairs. This is right across the party, and that is why it's really difficult for the Prime Minister. Clearly, a government having to rely on the opposition, on Labour, to get legislation through Parliament is never ideal. And tonight, the Prime Minister's in a very, very difficult position. And I say difficult position not just because, yes, he's got through, Plan B is now in effect across England, but ultimately, where does he turn next? Because there are concerns, and you've addressed some of them tonight from scientists, that actually Plan B is not nearly enough, that this virus is spreading so quickly. 8 MPs tested positive today, by the way, so quickly throughout the UK that further action will be needed. Can Boris Johnson potentially take his party down that route, given today's rebellion? You'd have to conclude possibly not. And that's the concern. And Boris Johnson promised MPs just before the vote, in an attempt to try and win some of them over, that he would recall Parliament before any significant changes were made to the rules. So for scientists tonight, for opposition parties, for people like Nicola Sturgeon, they're arguing this is very damaging for trying to protect people, because they're concerned that the sheer transmissibility of this virus means that hospitalisations will increase in the days and weeks to come. For others, though, and for those Conservatives, this is a bloody no for a Prime Minister, and many of them tonight, Colin, calling loudly for the Prime Minister to change, and to change quickly. One senior Conservative saying that a leadership challenge is on the cards for next year unless the Prime Minister changes tack.
Darren, thanks very much indeed. Well, let's turn to Andrew Bridgen, the Conservative MP for North West Leicestershire, who joins me, I'm delighted to say, here in the studio. Andrew, thanks very much indeed for coming. I do appreciate it. Let's just try and look at the positives for a second. If you're in government tonight, the numbers look dreadful. It could have been worse, couldn't it, in terms of party management? The whips will be pleased that no junior ministers have decided to resign. I think I'm right in saying that, at least.
There was a lot of a very heavy whipping operation on the PPSs and the junior ministers who were wavering. That's been going on for several days. So, yes, they've done that. I suspect some of the waverers will have been slipped, so they didn't have to be present for the vote. They may well be in the abstentions. I haven't seen the list, but it was a bigger rebellion than I thought we were going to have.
What did you think? What did you expect?
I was thinking if we got to 75, that would be very good. To get to 100 was beyond our expectations.
Did you have one of those mind maps that journalists are fond of? So you sort of think, well, if it gets to 90, that means this, and if it gets to 150, the Prime Minister's finished. Did we have any of those sort of trigger points?
Not really. At the end of the day, I never really want to comment on how other colleagues will vote. It's each MP should vote without fear or favour what they believe in the interests of their constituents and the country. And I knew there was going to be one MP in the no lobby on COVID passports, and I said that the other day. I think that's in the best interest. I think when we go on to controlling where people can go and having to show papers effectively, I think we're breaking the contract that we have with our electorate. That's crossing a Rubicon that I didn't want to cross. I think we sent a very strong message to the government and to the Prime Minister, because what a big worry was that everywhere they've been introduced around the world, they've always spread to other venues, and I don't think an Englishman should have to show papers to go to the pub.
No, it feels like the thin end of the wedge for a lot of people. I just wonder, actually, people have overlooked in the media coverage I've seen so far the other two votes because they seem less dramatic, but actually, if you look at them, there's evidence of militancy there as well. I mean, on mandatory vaccinations for NHS employees, I mean, to have, a three-figure rebellion on that, even 40-odd for masks in certain venues.
Well, I must admit, I voted on all those issues against the government. The NHS, it seems ludicrous to me when you'd risk, when we're looking for an extra 50,000 nurses, the NHS is under extreme pressure and going to be all winter, that we'd risk losing 123,000 staff because of this issue, when if they were laterally flow tested every day as they come to work, we know that even the double jabbed and the boosted staff can still contract and transmit the virus. They'll be at no more risk of, or no more danger to the people they work with or the people they're serving. And I interrogated a doctor on our benches, one of my colleagues, and I said, what's the cost of recruiting and training 123,000 people when we've already got them here? And it would be huge for the NHS. Logistically, an absolute nightmare. I don't think it's really feasible. So the answer is that we laterally flow test them. Yeah. And another absurdity and an inconsistency would be that there's no account taken for all those members of staff who haven't had the vaccine but have had COVID, which all the science says would give them more protection than having any of the vaccines. But they'd be sacked just the same.
In terms of where we go next, and in terms of whether England goes a little closer to what Scotland have done today, and perhaps look at something that's a bit more like lockdown light. Are you looking at your Christmas diary and expecting to be recalled to Parliament to talk about the next steps to authorise further COVID lockdown-style measures?
Well, I think it's interesting. You look at the lockdowns, and the Labour regime in Wales have always locked down harder than we have, and yet you look at their outcomes, they're suffering more from the virus than England is. It doesn't really make sense. If Omicron is, as I hope, a mild variant, and the NHS can cope, then the good news should be that we will not need to come back and debate further measures. But it's reassuring that we're not going to have government by diktat over Christmas, and the Prime Minister has committed that if further lockdown measures restrictions are to be imposed, that we're going to recall Parliament. And Colin, that's the way it should be.
Yeah, though in truth, to stop the government doing what it wants with Labour Party support means that, in a sense, it's a kind of token gesture. Just in terms of the Prime Minister's authority in all this, I mean, Westminster correspondents are fond of saying that rebels and being a rebel is sort of habit forming. Once you've done it, it becomes easy to do it again. In your experience being on the backbenches, is that true?
Yes, the first time when you're newly elected, you don't actually go to Parliament to vote against your own government. Yeah. And it did give me a little sickening feeling in the stomach. But quite honestly, looking back over the last 12 years as being an MP, and when the whips say to me, Andrew, you're voting against the government, I'd point out if I hadn't voted against the government in 2011 for a referendum, we never would have got one. We wouldn't have left the European Union, and probably my whip wouldn't have his seat now. That tends to shut them up a bit. I tend to regret the times I didn't vote against the government. I can't actually remember ever voting against the government when I didn't feel it was the right thing to do, and I still feel it was the right thing to do. And
do you still feel Boris Johnson's the right man to lead the party in the country?
Well, he can be. He's a great campaigner, he's a great politician, but ultimately, in the Conservative Party, we have to be ruthless. We're noted
always have been.
We always have to be. Because, Colin, the alternative to the Conservatives being in government is the Socialists, the Labour Party being in government, and I came into politics to prevent them getting into government and dealing the disaster they always are on our social fabric and our economy. And it's nothing personal. It's just that I can't put the country through a Labour government.
And just hypothetically, who would it be right now? Would it be Rishi Sunak? Would it be Liz Truss? Would it be?
I'm sure there are many contenders, and again, I'm just one Conservative MP. We're not there yet. The Prime Minister's got time over Christmas to think about what's been going on over the last few weeks, but we can't carry on like this.
Andrew Bridgen, appreciate you being so frank and coming in. Thanks very much indeed. After the break, going to be looking at the increased backlog of cancer cases now that the government is focusing solely on the booster programme. But what about those waiting for treatment? We'll bring you more on that.
It's time to remind ourselves there's always another winter. Canary Islands sponsors the weather.
Hi there, welcome to the latest forecast. There'll be a lot of cloud during the next 24 hours, shrouding the hills of the western UK and keeping things mild. There'll be some rain as well, but that will tend to ease later as this area of high pressure moves in for the rest of the week and begins to properly settle things down widely. Before that happens, these weather fronts and these tightly packed isobars across northern parts of the UK bring wind and rain for Tuesday evening. Some heavier rain at times for the northwest Highlands, but through the night, the area of cloud and rain across Scotland sinks south. It clears from the far north and northwest, but it edges into Northern Ireland, parts of northern England as well. It stays cloudy across southern areas, but through this slice of central UK, clearer spells and perhaps a few pockets of fog first thing. A chilly start here as well, and once the fog clears, plenty of sunshine emerging across parts of North and East Wales, the Midlands, eastern England. Also turning brighter to the north of the Central Belt, some decent sunshine here and less windy compared to Tuesday. Otherwise, a lot of cloud cover, some light outbreaks of rain and drizzle, more persistent damp weather for parts of Northern Ireland, southern Scotland and northwest England. And this area of cloud and outbreaks of rain starts to move north once again on Wednesday evening, pushing into the rest of Scotland eventually overnight. Meanwhile, it stays mostly cloudy across Wales, southern and southwest England. But for the Midlands, eastern England, southern Scotland, clear spells, which will lead to, in some places, frost and even fog to begin things on Thursday. Once any fog clears, though, the best of any sunny spells will be across eastern Scotland, southern Scotland, northern and eastern England. Generally cloudy skies elsewhere. The rain in the far north of Scotland eases through the day so that by the afternoon actually many places are dry, but it will turn a bit colder. High pressure is extending across the whole of the UK on Thursday and Friday. It will bring a lot of cloud, but it will also turn things colder.
Canary Islands sponsors the weather.
You're watching GB News live across the UK and the world on our digital stream.
GB News is Britain's news channel.
We are the UK's home of discussion and debate from all perspectives.
We are here for you. Don't forget to join our YouTube community by clicking on that subscribe button.
And if you want the GB News app, you can click and catch up on programmes anytime.
We love to hear from you, so email us.
gbviews@gbnews.uk.
Thanks for being part of the GB News family.
My name is Andrew Doyle. Join me every Sunday evening at 7 p.m. for Free Speech Nation, This is a show where we address current affairs and news stories of the week with the help of two wonderful comedian panellists. I brought in comics because I want to give it a lighter edge, and also they work for less. See you there.
Join my show Farage, 7 p.m. till 8 p.m. Monday through Thursday, and there you will get opinion, analysis, debate, and I'll cover stories that nobody else dares to touch. And then for the last 15 minutes, talking pints. We're over a drink. We have a civilised conversation with someone. We very often disagree, but we do it in a grown-up way. Come and join me on Farage.
I'm Colin Brazier. I've reported from more than 70 countries around the world, covered wars from Afghanistan to Iraq, from Lebanon to the Balkans. I'm trying to bring that experience, that feel for events, to the studio. And something else. I'm ready to give an opinion. Today's stories with a spark. Brazier from 8 p.m. weekdays on GB News.
Join us for the Political Correction. We're here every Sunday to correct politics and put you, the people, back in charge.
We talk about all areas of the United Kingdom, including Northern Ireland.
Our debate goes way beyond the Westminster Village. It's about the real country. It's about your opinion. So please, we want you to tell us what you think.
This is the Political Correction.
Every Sunday morning from 10 a.m. here on GB News.
You're watching GB News live across the UK, the world, and our digital stream.
GB News is Britain's news channel.
We are the UK's home of discussion and debate from all perspectives.
We're here for you. Don't forget to join our community by hitting the subscribe button.
And download the GB News app so you can click and catch up on programmes anytime.
We love to hear from you. Email us at gbviews@gbnews.uk.
Thanks for being part of the GB News family.
Well, my late wife, Joanna, to her family and friends, died of breast cancer 3.5 years ago. There was probably nothing we could have done to halt the inexorable progress of a disease which, in killing her, deprived our 6 young children of a mother. But I wouldn't be human if I haven't occasionally wondered if she might still be with us had the NHS not dropped the ball. Jo's diagnosis came late in the life of her tumour. It might have been detected sooner had her routine check-up appointment materialised when it ought to have. Well, as anyone whose life has been touched by cancer will know, the chances of survival improve sharply if the thing is caught early. I don't especially blame the NHS for what happened. It employs many well-meaning and brilliant practitioners. And her cancer was so virulent that I'm not really sure any medical intervention, however early, could have possibly saved her life. But it does mean I paid particular attention to those headlines this morning about the effect of COVID Plan B on cancer referrals. The Daily Telegraph, for instance, reporting today that 5,000 cancers a month could be missed because our GPs are being told to axe routine appointments to make way for COVID jabs. Those jabs are important. We keep being told to expect a tsunami of infections. And as someone who's had his booster, I'm supportive of almost any plan, so long as it's not compulsory, that involves inoculating as many of us as possible. But we must avoid creating a situation where more people ultimately die of cancer than do of new COVID variants. We're told that's not likely to happen, and yet we are entitled to wonder if those who decide where clinical priorities lie sometimes see the bigger picture. Think of the attention given this week to the solitary British fatality attributed to Omicron, and remember that each day in this country there are more than 400 deaths caused by cancer. It's not clear how many more cancer deaths are happening because of COVID. It's certainly reasonable to assume there's been a significant rise. All those missed appointments, yes, but also the abandoned treatments, the chemotherapy and radiotherapy courses that never got off the ground during lockdown and only recommenced when it was too late. But also things like cancer drug trials. When Jo was terminally ill, we looked desperately around at what was in the experimental pipeline. There was nothing that fitted her type of cancer, but other patients did and do get lucky. But when COVID came along, these opportunities for a few extra months of life, or sometimes a miraculous reprieve, never left the laboratory. So, for instance, in the first year of the pandemic, 40,000 cancer patients were denied the chance to go on drug trials. Only a third of those who normally roll the dice like this did so that year. So I'll ask again, what has been the impact of COVID on cancer? How many more of us will die, have died already, or are dying right now, oblivious to the fact, because coronavirus has effectively sucked all the medical oxygen from the treatment room? Well, if we take the cancer that killed my late wife, we know from charities that almost 1 million British women missed a breast cancer screening in the first wave alone. American data suggested that at the height of the pandemic, the number of mammograms in the US fell by 80%. We will never know definitively how many lives have been and will be cut short by the effect of the COVID emergency on cancer treatment, lives that would have been prolonged had the virus not hoovered up the resources that normally go elsewhere. It's certainly true that the NHS has been making progress catching up with its backlog, but with every fresh and new interruption, that process goes backwards. If the events of this week tell us anything, it's this. Every new variant which now comes along and shows signs of running rampant will be the cause of a massive institutional seizure for the NHS. A triaging decision that will lead to the prioritisation of COVID, the renewed sidelining of oncology, and the premature deaths of women who would, in normal times, be around to see their children grow up. That's the Brazier angle. Well, I'm delighted to say we're joined by Professor Prof Sikora, who joins me now. Professor, thanks so much for your time. Do very much appreciate it. Can we say with any confidence how many more deaths we can attribute to the fact that we are not treating cancer in the way we would because we are prioritising with our resources COVID?
I mean, you've summarised it very well, Colin. I think it'll take 2 or 3 years before we'll really know. It's probably going to be around 50,000 deaths extra due to 2 years of COVID. And as you rightly say, every little blip, every little panic, Omicron coming along, targets the 3 areas the most. One, the patient. They become more frightened to use health services because they're scared of COVID. The second, the GP, who is now taken off to do injections for the booster. And thirdly, the hospital service, which has to clear beds, stop operating to try and get people in case they need it. The good news really has been for the last 3 weeks in South Africa, who are 3 weeks ahead of us in the Omicron business, that the number of people going into hospital, the severity of their illness, and the recovery is so different from Delta. It's much, much better. And maybe we're panicking about nothing. It seems reasonable to do the boosters, but let's not panic. Let's not cancel things on the cancer front and the heart disease front. Let's keep going. It's important we do.
Well, come on, maybe if we've got time at the end to reflect on what's just emerged from South Africa, not just what we heard on GB News last night from the clinician who first came across it and alerted the world, but also from this study looking at its potential lethality. But just in terms of the story I mentioned there in my introduction about the Daily Telegraph story, and the role of the GP in referrals, and this idea that if you are switching the GP, the gatekeeper, the person who makes that initial referral of somebody who they're not quite sure, maybe they've been losing weight, whatever it is, and they refer them on. And if they're not referring on, if they're not seeing patients in the ordinary run of things because they're too busy worrying about jabs, that becomes the problem.
It does. And, injections of vaccines is a logistic problem. It's not a skill problem. It's dead simple. You can train someone in an hour with an orange and a syringe to do it. So that's not the problem. Sure, you have to have a doctor present when you're doing a vaccination clinic in case someone keels over, faints usually. That's usually what happens. But it's vital that GPs go back to actually doing what they're good at doing. Sifting out people that have serious illness from those that have less serious illness, sifting out patients that need further tests, scans, biopsies, endoscopies where you put tubes in various places and get snippets of cancer out, because that's the only way we can diagnose cancer. And if the general practices are obsessed with boosters, then we're stuck. And the whole entry into the NHS is through primary care, through the GP. So it's vital they're providing a service, they're seeing people, they're looking at them in the eyes so they can understand, are they really ill? And if they are, they need to be referred on for investigation.
I'm sure in the course of your career, Carol, you've had many conversations with desperate and dying patients who look at the possibility offered by a drug's trial, something which is largely untested at an experimental stage as a last hope. And sometimes I'm sure you've seen those stories end well, and perhaps more commonly rather less well. But the fact that those trials have to some degree dried up and the opportunity they provide oncologists like you is also part of this problem.
We're at a very exciting time in oncology. I've been in it a long time, nearly 50 years, and I've never been in such an exciting period in terms of the drugs that are available and the mechanisms by how those drugs work and our ability to predict. Mrs. Jones and Mrs. Smith have breast cancer, but they have different types of cancer. And now we can understand that. And we can select treatments for Mrs. Smith and so on that are different and really tend to work as opposed to not work in the past. So it's an exciting time, but it does depend on trials, on investigations, on biopsies and so on. And it's sort of ground to a halt in the last 18 months. And we've got to get it moving again. And we've got to get away from being obsessed with COVID, moving into the other diseases that really make up the bulk of human suffering.
Can I just go back to where we started? An extraordinary piece in the Daily Mail today, a first-person piece written by this South African doctor who first, as I say, alerted the world to COVID. And she was very much of the view that we in this country are overreacting to Omicron. And then we have the studies also coming out, which are tweaked to take account of the fact, and some people have been concerned with comparing apples and oranges, but tweaked the fact that you're dealing with a younger population in South Africa, and still demonstrated that Omicron is at least a third less virulent than the strongest Delta variant that we've had so far. And yet, we're left with this dreadful calculation, aren't we? It may be weaker, but if it's 8 times more transmissible, we're still going to get a potential, I hate to use that word, but the word tsunami of infections.
That's the problem. We just don't know what's going to happen, Colin. That is the crux of the whole thing. If it's like South Africa, and we age correct, and so we can see what it would look like in an older population, remembering that our population is more highly vaccinated, even with 2 shots and now with boosters compared with South Africa, then we just have to wait and see what happens. The key figure to watch every day, and I've been watching it, at 4 o'clock, you can get it, number of people put into hospital in the previous day or so. There's a bit of a lag in getting that information. But today, for example, it was around just under 800 people. It's not going up. Now, okay, the cynics would say it's too early to see the effect of Omicron. But, in the next few days, if that goes up, then we should worry. If it stays flat or just goes up a little bit, we can relax because the hospitals won't get swamped. Hospitals are not going to get swamped. We can carry on business as usual for cancer and all the other ailments that we treat in hospitals. And that's the key, not to panic.
Numbers when they come out. Carol Sikora, thanks so much as ever for your expertise. Thanks a lot. Who'd run a pub or a restaurant, hotel or cafe? These are dark days for Britain's hospitality industry. Just as thousands of businesses were hoping to make back some of what they lost earlier in the year, along comes Omicron. Boris Johnson has made it harder to go to the office than to a Christmas party, but even so, individuals have taken it upon themselves to do what Whitehall wouldn't. Many are cancelling Christmas parties without being told to do so. Well, in one part of the UK, the hospitality sector is finding life even harder today, though. In Scotland, screens and queues and the whole panoply of social distancing will be coming back in pubs and bars. First Minister Nicola Sturgeon also said today that keeping your celebrations as small as family circumstances allow is sensible. Well, in a form of words we thought we'd heard the last of. Scots were told by the SNP that they will no longer be able to mix in groups bigger than 3 households. What does it mean for Scotland? What does it mean for hospitality? Let's turn to someone in a position potentially to answer both those questions. Leon Thompson is the Executive Director of UK Hospitality Scotland and joins me now. Leon, thanks for your time. Do appreciate it. The timing couldn't have been worse for this, could it really?
No, the timing is absolutely awful. Christmas and New Year are the crucial period for hospitality businesses. Businesses make around about a third of their revenue at that time, and businesses were hoping and absolutely desperate to receive a boost of income, and that's just been taken away from businesses over the last few days. First of all, with an announcement from Public Health Scotland advising people to cancel their Christmas parties, and then today's announcement as well, limiting or advising people to restrict their gatherings to no more than 3 households. It's just resulted in further cancellations amongst hospitality businesses. Cancellation rates are anywhere between 30 and 100% at the moment. Some businesses are losing tens of thousands of pounds through cancellations. Others are losing hundreds of thousands of pounds through cancellations.
And it's tricky. So I don't know what the situation apropos furlough will be and payments to businesses in Scotland, but in England, the view is that unless government dictates that you will close, then the furlough and any kind of compensation scheme is not available. The tragedy of all this, Leon, of course, is that, we just heard from one of the most respected clinical voices in the country, Prof Sikora, saying that keep your eye on those hospitalisation figures at 4 o'clock every day. They may start to show over the next few days nothing, and that all this may have been for nothing.
Yeah, absolutely. And, there is a strong argument to make sure that our politicians are holding their nerve on this. But I mean, clearly, words like tsunami, avalanche, these are the words that are and phrases that are being used when describing the number of cases which are coming forward, which may not be resulting in hospitalisation, but people are picking up infection, and we're moving back to where we were months ago in terms of restrictions within hospitality. The way things look at the moment, there are businesses that will just close. There are businesses that will not reopen. They have no more finance that they can draw on to keep going. Christmas and New Year, that's the time when businesses can earn money to sustain them through the lean months of January and February. That's in normal times. Even more important for businesses which are now saddled with so much debt. But they can't do that now. And the phones are ringing, emails are coming in, people are cancelling, and businesses are considering their future, and they're having to let staff go already.
Yeah. Let's assume for a moment, though, that Prof Sikora is wrong, and that tsunami is heading our way. Maybe it's not as bad as some is predicting, but it is bad enough. Bad enough, as Chris Whitty, the Chief Medical Officer, said in London in the last day or so, that actually part of the problem for hospitality might not be demand, it might be the supply side. It may be the fact that actually you've got so many bar staff ringing in, having been pinged or not feeling very well, that actually that becomes a problem too. You can't get the staff anymore.
Yeah, absolutely. I mean, hospitality has faced a lot of shortages around staff in the last month since the economy restarted. But yeah, I mean, we could very well be going back to some kind of pandemic, potentially, as people contract Omicron and then have to isolate. So that is a big concern. I mean, as things stand at the moment, businesses here in Scotland have effectively been closed through the public health messaging. However, there is no meaningful financial assistance for those businesses, and obviously there is no furlough for workers at the moment. So it's a dire situation.
And then a final thought, really, and it's about the leadership of the First Minister and the SNP Green Coalition, and about the fact they do seem to be, when it comes to striking out in a draconian direction, consistently hard line. I mean, from where you stand, do you feel there are enough voices in Scotland standing up for the position you occupy, which is frankly pretty beleaguered tonight?
Yeah, I mean the Scottish Government has always been far more cautious in its approach around COVID, and businesses here have spent more time being closed than their counterparts in England, certainly, and that has put our businesses and our sector at a real disadvantage compared to hospitality businesses south of the border.
Thompson is the Executive Director of UK Hospitality for Scotland. Leon, thanks for your time. Appreciate it. After the break, going to be speaking to the barrister Adam Wagner about the legislation surrounding COVID restrictions and whether this is encroaching upon our civil liberties and whether, frankly, this is all going to become a regular feature of Christmases to come.
You're watching GB News live across the UK and the world on our digital stream.
GB News is Britain's news channel.
We are the UK's home of discussion and debate from all perspectives.
We are here for you. Don't forget to join our YouTube community by clicking on that subscribe button.
And if you want the GB News app, you can click and catch up on programmes anytime.
We love to hear from you, so email us.
gbviews@gbnews.uk.
Thanks for being part of the GB News family.
My name is Andrew Doyle. Join me every Sunday evening at 7 p.m. for Free Speech Nation. This is a show where we address current affairs and news stories of the week with the help of two wonderful comedian panellists. I brought in comics because I want to give it a lighter edge, and also they work for less. See you there.
Join my show Farage, 7 p.m. till 8 p.m. Monday through Thursday, and there you will get opinion, analysis, debate, and I'll cover stories that nobody else dares to touch. And then for the last 15 minutes, talking pints. We're over a drink. We have a civilised conversation with someone. We very often disagree, but we do it in a grown-up way. Come and join me on Farage.
I'm Colin Brazier. I've reported from more than 70 countries around the world, covered wars from Afghanistan to Iraq, from Lebanon to the Balkans. I'm trying to bring that experience, that feel for events, to the studio. And something else. I'm ready to give an opinion. Today's stories with a spark. Brazier from 8 p.m. weekdays on GB News. Well, there were appeals to liberty, the rule of law and individual conscience in that parliamentary debate on Plan B tonight. But at Holyrood, Nicola Sturgeon was keen to stress she wasn't making things unlawful, at least not yet. So is the law a weapon against COVID or the ultimate shield against for a citizenry whose rights are being trampled all over by panicking politicians? Doughty Street Chambers barrister Adam Wagner joins me now. Adam, thanks so much for your time this evening. Do appreciate it. I suppose for those who believe in parliamentary democracy and through it the rule of law, there was a crumb of comfort tonight in the government saying if it plans to introduce any further COVID restrictions in Westminster, it will have to recall Parliament over Christmas.
Yeah, I mean, I guess it's a crumb. I mean, tonight was probably the first proper debate with actual, with real exchange of views in Parliament we've had over any COVID laws. I mean, I think it was only the fourth debate by my count out of over 100 COVID restrictions laws that have been passed in the past, almost 2 years. There's only been 4 times that the government has placed the laws, before they come into force or just after in front of Parliament. So, we're getting there, but it's very, very slow.
And it reminded me of how useful it is in terms of unpicking the debate a little bit by having separate motions. So you get the mood of the House, you get proper debate, up to a point, Lord Copper, on, how we feel about masks, how we feel about compulsion when it comes to vaccine passports, or indeed compulsion when it comes to injections for NHS staff. And you've got different, varying degrees of rebellion on the Tory backbenches according to each individual topic. But it got us away from this idea that it's all lumped together and you're either for it or against it.
Yeah, I mean, but we're still. I totally agree. I think the more motions, the better. The more debate time, the better. But it's still, we received this law. This law is 25 pages long, 12,000 words. It arrived at 5 o'clock yesterday afternoon. And it can't be amended. So it was a straight up yes or no. Although a straight up yes or no on 3 different motions. So I still think, in terms of parliamentary democracy and debate, given that COVID passes have been in quite detailed form, a policy since the summer. They were in the Plan B and Plan C, the documents the government produced. They're not a secret. There really isn't any excuse for not having done this through primary legislation. And I think, parliamentarians have become used to or immune to, if you use that phrase, this reduction in the opportunity for them to get involved.
Immune perhaps to the sight of the Prime Minister going on television to announce what they should be hearing first.
Yeah, I mean, I think, look, there's a legitimate debate over the extent to which Parliament has to, or the government has to, use emergency laws when there's a real emergency. I mean, there's no doubt that Omicron has come almost out of nowhere. It's happened very quickly, but equally, as I said, with COVID passes, with all the policies that we've got now, none of this is new. If we have a lockdown, we know roughly what will be in the law, but it should all be put it on a sort of permanent, not a permanent basis, but a proper basis in primary legislation. If the government's got more than a few weeks to plan, which it has, and I think the government has been allowed to use these measures too often, and it's a real shame because you saw tonight how important it is to properly debate these really big changes in our society, even if they're going to be temporary.
Hugely practical. I mean, that's the problem sometimes, that when the government's announcing or circulating some of these ideas, it can all feel terribly legalistic and abstract. But actually, it poses genuine problems. I mean, if you are the prosecuting authorities or the Metropolitan Police trying to work out whether the Prime Minister's committed an offence, for instance, by hosting a virtual quiz from Downing Street, I mean, you can see why the law in the abstract then becomes quite difficult for the people who actually have to put it into place. And that's only one example of dozens.
Yeah, I mean, that's been a problem with COVID laws here. It's actually been a problem all over the world, and I've looked at this a bit. But, we've had laws that have changed. When we get into the, this kind of situation where the cases are rising very quickly, things change quickly. The law's changing every day or every other day. We had 3 new laws yesterday. They've all been voted in today. It's really difficult for police to keep up with, for venue owners to keep up with, for local authorities who are going to have to do pretty much all the enforcement of these new COVID passes to keep up with. There's lots of complicated stuff in there about, whether people are standing up or sitting down during events and the effect that has on whether you are going to have COVID passes or not. So I know I sound like a broken record, but what this all comes back to is we have this tried and tested way of scrutinising complicated laws, which is primary legislation, where stuff gets published in advance. It goes through different committees. It goes through the different houses. It has days potentially of time to debate. And I really think somebody in Parliament has got to put their foot down with the government and say, look, this isn't good enough. We want to see stuff in advance, even if it means you having to reveal your hand about how you're thinking about policies, and maybe the public getting a bit worried, seeing it in the flesh. But I just think it's not helping the law. It's not helping anybody. These laws being sort of sprung on us. It's coming into force at 6 a.m. tomorrow morning. That's less than 48-hour lead time for business owners and local authorities to get their heads around it, let alone Parliament.
Well, Adam, just a brief thought. You mentioned you've looked around at how different parts of the world do this, and I mean, even within our own United Kingdom, there are obviously differences of approach. And I was quite struck listening to Nicola Sturgeon. There seemed to be a determination not to invoke the law where possible, to make it guidance and advisory. But as you look around the world, who's doing it better than we are?
I'm not sure. I don't know that there is anybody necessarily who has figured out how to bring in laws that that restrict our everyday movements and not make them complicated and difficult to understand. So I think around the world it's different everywhere. But you'll see, I think it's really interesting, and you said it in the introduction about, can guidance play the role of law? Because ultimately the vast majority of people in relation to COVID will not come into contact with law enforcement, but they'll do what they're told to do. They've been doing what they've been told to do regardless, because I guess it's the right thing to do, or maybe they're a bit worried about being against outside of the law. But there's a very complicated sort of psychological calculation to be made about whether to bring things in as law or guidance. But the most important thing ultimately is that people aren't confused, and that it's very clear what they can and can't do, or what they should and shouldn't do, and what is guidance and what is law. And we saw that with the Christmas parties. There was guidance, there was law, not easy to understand. And I think we're going to see that. I'm fairly confident we're going to see something similar to Scotland here soon, which will be some sort of guidance which says don't mix, maybe don't have a party of more than 3 households, something like that, because the government seems very, very keen not to use the law. But I'm not sure whether it's going to make things better or worse, because people will, having been used to this all being law, may be confused about, well, if something's guidance and something's law. Face coverings are law, but mixing is guidance. I'm not sure it's going to necessarily help.
It's always very refreshing when somebody answers any COVID question with the words, "I don't know." Thanks very much indeed, Adam Wagner. Now, in the 1960s, the closure of a third of Britain's railway network was ordered by a civil servant tasked with its rationalisation. He was Richard Beeching, and forever after, what became known as Beeching's Axe has been the cause of a great many bitter recriminations. Some famous branch lines that were axed have recently been revived, far too few of them, but it's not always easy. And if reports are to be believed, it's set to get harder. Campaigners claim that civil servants in charge of Britain's roads are accelerating plans to destroy Victorian bridges in such a way that will make the restoration of former rail routes effectively impossible. Well, joining me now is a member of the HRE group, Grima Bickerdijk. Welcome to you. HRE group, we need to explain that for people. What does it mean?
The HRE is the Historical Railways Estate, which is a collection of 3,100 railway structures that are managed by National Highways on behalf of the DfT, who own them.
It's an alphabet soup of acronyms, isn't it? But is my broad introduction correct to say that there is a bit of a tug of love going on about some of these bridges between people who would like to see rail links restored in parts of the world where they used to be, and those people who actually don't really care for them all too much?
Actually, it's more about active travel than railways, if I'm honest. A lot of the structures that National Highways manage have great value in terms of future active travel routes, walking and cycling. A handful are proposed for reopening as part of railways, but there's also a collection that are useful to heritage railways, steam railways, who have aspirations to expand. So this estate of redundant infrastructure, as we emerge into a new era where we're much more sustainably focused and indeed ecologically focused, because ecology is part of this equation as well, the value of these assets becomes much greater.
As we read about in the newspaper suggesting that some of these bridges have been concreted up. I mean, clearly, these are sometimes quite big structures, old structures, sometimes not in the best of conditions. So there is a safety question.
There is absolutely a safety question, but particularly with masonry arch structures, they are extremely resilient. And there was an infill scheme in Cumbria at Great Musgrave, where there was a delightful masonry arch structure that was needed by 2 heritage railways either side of it for a reconnection of their operations. That was infilled with about 1,000 tons of aggregate and concrete over the summer, without National Highways speaking to either of the railway operations. So these 2 bodies had been seeking to reunite for 25 years, and suddenly their opportunity to do so is blocked by the state-owned roads company out of the blue, who didn't say anything to them about it. That's a kind of wrecking ball attitude that has characterised National Highways management of this estate over the past year. And it's something we're trying to avoid because there's dozens of these structures that they have earmarked for infilling and demolition. And many of them do have absolute and clear value as assets for future sustainable transport use.
Mr. Bickerdike, really appreciate your time. Thanks ever so much. Well, that was your one reprieve from having to think too hard about COVID. Let's go back to what's happened tonight. Big votes in Parliament. We posed a very specific question for you, and getting on for, well, in excess of 4,000 of you have had your say. Should GPs be putting boosters for healthy 20-somethings ahead of testing older folk for cancer? Joe says they shouldn't be putting boosters for healthy 20-somethings ahead of cancer screenings for any age. Lee, but cancer tests for old folk doesn't get the practice a fee each time like they get for the booster. Deeply cynical. Jamie, I'm a healthy 27-year-old who will survive this over-dramatised flu. People die a long, miserable death from cancer if not found early. More cheery thoughts to come. Here's Dan Wootton.
It's time to remind ourselves there's always another winter. Canary Islands sponsors the weather.
Hi there, welcome to the latest forecast. There'll be a lot of cloud during the next 24 hours, shrouding the hills of the western UK and keeping things mild. There'll be some rain as well, but that will tend to ease later as this area of high pressure moves in for the rest of the week and begins to properly settle things down widely. Before that happens, these weather fronts and these tightly packed isobars across northern parts of the UK bring wind and rain.